introduce her, so I'm going to just say hello to everybody. My name's Debbie Pearson, and hopefully everyone knows that I work with the Wellness Committee, and I'm awfully glad to see you here so we can talk about doctor appointments. Does anyone ever go to doctors' appointments? I had no idea. Hank and I have no doctor appointments this week, so we are so excited. It's like a week off. We're going to figure out what to do with it. But we're going to talk about maximizing your medical appointments, because every time you go in to see a doctor, you should have a mission, things that you want to accomplish. This is not a social visit. This is not your great day to go out on the Westminster shuttle and get to see people out. This is actually to achieve a mission and get what you need from the appointment. Whoa. Hold on, this is not my Mac computer. Give me a second. Okay, there we go. Is this what your medical care feels like? Where you wait for that moment. It has changed so much. And I'll just have to tell you a little bit about where I get my experience with doctor's appointments. I spent the first 20 years of my nursing at St. David's Medical Center when it was the only St. David's. And then the next 25 years, actually, we're celebrating this year, 25-year anniversary of Care4, which was a little company I started, a care management company, 25 years ago. And that's when I started seeing individuals that were not in the hospital, but that I worked with to get to doctor's appointments, to help them with their medications, to help them at the end of life, to help them get the care they needed. During that period of time, I averaged about 8 doctor appointments a week with my patients, each with different goals, 8 a week. Let's say I worked 50 weeks a year for 25 years. That is over 10,000 doctor appointments. So there's the good, the bad, and the ugly with my experiences. But I go back, and probably some of you do too, when you went to the doctor, one person would put you in the room, you would take off your clothes, put on a hospital gown, and you would have a physical examination. Does anyone remember that? Okay. So we're on the same team, where now, even your annual physical is not a physical. No one touches you. It's an annual interview. What that means, more and more, it's on you to bring to the doctor what's bothering you, because he will very likely not see or touch any part of you that's the problem. So remember, it's on you. Remember, the times have changed. And if you like it or don't like it, your doctor doesn't either. They are not happy doing 20% patient care and 80% administrative work. There are no physicians that are happy with that. So let's look at what we can do to make it all work better. You can't change the system or control the pressure that your doctor is under. So the things you can do is, when you arrive for the appointment, be organized, understand what illness you're there for, know what you want to accomplish, and communicate clearly. Part of the problem with this is, by the time you get out of your apartment, get to the doctor's office, you sit in the waiting room for far longer than you should, because you're all arriving 15 minutes early the way you've been told, right? So then you're waiting 30 or 40 minutes. One person puts you back in the room. A second person comes in, takes your blood pressure. A third person comes in, gets all your medicine straight. A fourth person is the physician's assistant or the nurse practitioner. And then the very last person is a doctor that comes in knowing he has less than 5 minutes that he can spend with you and then gets out. So to waste any time, you're not going to get accomplished what you want. So that's what we're going to talk about today. And what's really, really vitally important is to have a clear vision of your goals. And I have very specific goals of care, but that's because that's what I focus on. But each one of you should have a goal of care for your health care. And it can be things like, I want to live forever, do every single procedure you can possibly do on me because it's got to keep going. On the other end of the spectrum, the person that says, let nature take its course, don't give me pills, don't give me procedures, and then there are all the pieces in between. So if you could say you had a goal of care, think about it for a second. What if you had to tell your doctor one goal of care that you have today, what you're focused on? I'm going to ask a couple of people to volunteer and tell me what your goal of care would be going to your doctor. Sheldon, where are you? You're going to the doctor tomorrow. What's your goal of care? Who told me? Where's Sheldon? All right, you're hiding?
I'm busy writing notes.
Oh, you're writing notes. Okay. Some brave soul. Tell me what's your goal of care. Okay, what's your goal of care?
The lowest pain I can have.
Absolutely. The least possible pain. That is many people's goal of care. Give me one other one.
I can answer that.
Okay?
I've got I had a blood draw a week ago, and I've got a list of all of the results of that draw, and that analysis, and there are probably 50 different items on that list. I'm focused on 2 of them, and I think I understand those, but my goal is really to understand everything that's important on that list and see where we are.
Perfect. Perfect. It's someone going in that's already had the lab drawn, has the results, and wants to understand the impact of those results. It's very, very specific. You're very likely to accomplish the mission that you go in for. So goals of care are very, very important. If all you want to do is maintain your mobility, be out of pain, be in control. I always thought that the number one biggest fear that people had was pain, and found out after years and years that is not across the board the biggest fear. The biggest fear is lack of control. So this is an area that you can control, is to have a very clear vision of your goals. And you have 2 options for care. One is standard of care, and that's where all the medical knowledge, all the research, all the specialists, the generalists, all that information with every clinical trial gets put in a funnel, and it comes out where there is a standard of care. We were talking about stroke the last time. The standard of care is if you have any signs of a stroke, it is immediately get to the hospital so they can find out what's going on to treat it. Stroke and heart attack, it's very time intensive. So that's where you get all your best care. But honestly, not everyone wants everything done. There's standardized care, And then individualized care comes from taking what the standard is and deciding what you want of that. If you get cancer, you can have chemo, you can have radiation, you can have surgery, you can do nothing, you can take vitamins, you have all these things. And individualized care is where the doctor doesn't decide your course. The doctor tells you options, and you have individualized care. It's more efficient for the doctor to look at it, go with standardized care, and just keep moving. But it's on you to say what you want individualized to you. And it can be very small things. I get my eye injections for my macular degeneration. Well, I love it. I still have vision. I'm grateful for it, but I'm a little bit picky. I want one thing done, different for me. They numb you up, they do all kinds of stuff, and when he's approaching me with the syringe, I just want one little eye drop to numb me right before the shot. Doesn't make any difference, it makes me feel better, and my retinologist knows it. So that's my individualized care, and he does it every time, and I never have to ask him anymore. So it can be a very little thing that you want your care individualized, and they can do that. But always remember, the choices are yours. What we heard about atrial fibrillation and all the different ways you can treat it, especially as you age and you start falling more. Do you want to be on blood thinners? Do you want other options? They're all standard of care, but the options should be individualized to you. And if I keep hitting that button, I will eventually learn this is not my computer. Never, ever, ever, ever forget you are the paying customer. You're not asking someone to do you a favor to take care of you. It's their job to please you. You are the customer. The medical providers did not choose to have 5 minutes with you. But the industry doesn't choose their bill rates either. Medicare, Medicaid, and insurance decides what is being reimbursed for the physician. And they are trying to keep medical practices open. It's a business like anything else, and they want it to survive. And we can do a better job of working with them to make it survive. We can always do better by advocating for ourselves and for being kind. I have seen so many times with the doctors running late, everything is behind schedule, the patient is exhausted, and by the time the doctor walks in, tempers are flying. It happens because you're sick, you're in pain, you're short of breath, you're worried, whatever it is. If you can remember to be kind, you want them to be kind to you, no matter what their day has been like. And the kindness goes both ways. And I've seen this be stretched a little bit thin. So I hope all of you remember that kindness will go a long way. And now I'm going to apologize for the next slides. I've got multiple slides with nothing but writing on the slide because there's a lot of information I want to convey. But you don't have to memorize any of this. You don't have to take notes. You've got handouts to support everything. You've got an actual clinical trifold brochure that lets you document what you're going to discuss at the appointment. So if you can just follow me as far as the concepts of what we're going to go through, I think that would be the most helpful. Before you even start, be informed by doing your homework. You may have diagnoses listed in your doctor's record that you know nothing about. When I've asked for a printout or gone into the portal and gotten a printout of all the diagnoses I have, I may know 4 of them, but gosh, there are 5 others that I don't know anything about. They're mine. You will be surprised, because very often there's a diagnosis that you had years ago. You had a resistant pneumonia. Well, it's still on there from 40 years ago. Maybe that should come off. Find your diagnoses either from your doctor or from printing out the portal, every single doctor you go to, and find out what you really don't have anymore needs to be removed. And it's not easy to get removed, but you can get it removed by talking to your doctor. And then research every diagnosis you have. Some of them you're not going to even understand. You've never heard the word before. Look it up, find out the information, and come to the appointment, whether it's prostatitis or prostate cancer or enlarged prostate. You know, it's all different things. What does your diagnosis mean? And please don't look it up on Facebook. Just as a favor, go to a reputable source. Go to Johns Hopkins. Go to the Mayo Clinic. Go to some established clinic, the Alzheimer's Association, the Parkinson's Society, a reputable site, and get the information and write it down. Because you may have 10 diagnoses. Write down what each one is. And what are your treatment options? Because there are all kinds of treatment options. Write them down so when you are talking to your doctor, you'll know and you'll be familiar with some of the treatments he's already talking about. And it's very helpful. Anyone has the opportunity to get baseline information, like what does your colonoscopy look like when you're not having any symptoms? If you're having a lot of reflux and indigestion, how about getting an upper GI? A hard one is cognitive screening. We've heard about neuropsych testing. It takes about half a day to get that done, but boy, if you can get it early, then there can be a comparison. Is your lung changing? Is your cognition changing? What is different? What is new? If you have a baseline of everything when you're doing well, then there's a comparison. So every opportunity you have to get a baseline study in any area is always preferred. Make a list of questions and concerns. I've talked to a lot of people who said they went to the doctor, like, oh, what'd they say? I don't know. Truly, it happens. What did you go for? A checkup. And what did he say? I don't know. Then don't go. If you're not going to know what you went there for, and you're not going to have concerns and goals, then don't bother. Prioritizing what is the most important to you, like not being in pain or finding out your lab results. Put that at the very top of your checklist, your doctor visit checklist. The most important items on the top, and include any recent changes. The value is to know what's going on now. And something that I fought with many times in taking patients to the doctor is this history lesson where they would go back to when they got their first pneumonia when they were in junior high school. And we had to hear all about it and how it was treated, and the doctor came out. By the time the story was finished, it was time to leave. We're not there for a history lesson. We're there for what is the problem now. Full disclosure, what is going on. If you have had bowel movements every day of your life and now you haven't gone for a week, it may be something you might not want to talk about. We could get Dr. from the GI office, Dr. Tao, here to talk to us for an hour about that again. But very, very important to have a relationship where you can discuss anything. Where are you itching? What is your problem? Do you wake up in the morning and for any amount of money, you would not be able to tell someone what the date is, no matter how much they offered you, and that's becoming consistent? Be sure that you have a relationship with someone where you can have full disclosure. And the red book that you were given is pretty much in place so you don't exaggerate to make a point. You don't want to exaggerate and go in and say, I am having indigestion all day long, every day. If you're having indigestion, write down the date, the time, how long it lasts, what did you eat. Get specific, because then when you come back and you say, well, it's not all the time, I have it twice a week. It's a lot different than stating your case that you have a situation that's going on all the time. If you're taking your nitroglycerin, are you taking it once a month? Are you taking it 3 times a day? Write down all of your current system, your complaints, what system is needing attention. And then when you go back and look in your health diary, your red book, not the history, but what's going on now, you'll have accurate information that can be treated based on the frequency of your symptoms. If you're talking to the doctor and something's unclear, ask. One of the biggest problems that I think all of us have is the doctor is talking to the screen with their back to you. They're talking very fast. English is not their first language. You can't understand what they're saying, and you're sitting there nodding your head. Have them stop. Be real honest and clear. I can't understand what you said. Or you spoke too softly or too quickly. Can you repeat that for me? Or let me repeat to you what I think you just said, and you tell me if I'm right or not. If their solutions are not consistent with your wishes, stop right there. If someone wants to operate on you, on something that you think with a little tweaking you can probably tolerate without a surgical procedure, stop and talk about it. Talk about your goals of care, what you think you can tolerate and what you think you can't tolerate. Your body, it's not the doctor's body, it's your body. So make sure that your goals of care are what are being treated. Being succinct and organized, respect everyone's time, and update your portal information. Do you get as many portal reminders as I do? Or am I the only one that it's like, update your portal? I was there last week. Why do I have to update my portal? How many of you are comfortable going in and updating everything on your portal? Raise your hand if you are. Yeah, this portal thing thinks a lot of itself.
Thinks a lot of itself.
It thinks a lot of itself. And that we're going to devote all this time to updating our portal. If you can, however, it is very helpful, and there are many, many people here that can help you with updating your portal. If not, just be honest when you go in and say, I can't do that stuff. Let me do it in the office. I'm going to come a little early and I'll update everything on paper in the office, because you want them working from correct information. Show up early for your appointment. Have your printed information, your medicine list, not what's prescribed to you. What are you taking? Because there's a difference. There are a lot of meds that have been prescribed to people that they're no longer taking because it bothered them, it cost too much, you had a problem with the refill. It's more about what you're taking. Write down everything you're your prescriptions, your supplements, your over-the-counters, everything. And when you come in, this is the hard part, use the fewest words to convey the information. Short sentence, very targeted information. Don't spend time repeating history, and ask questions that are clear, like the lab values. What do these two lab values mean to my health and my care? Not, I've been worried about it, I've looked them up, I've seen them, I know this is where they were, I know this is where they are. Ask succinct questions that are clear and easily answered and targeted. That's how you're kind to your practitioner. Clarity is kind. And on the little handout for the checklist for your appointments, there's room for 3 problems to discuss. If you get finished with your 5 minutes with the physician and you've only covered 2, that's okay. You won't always cover all of them. But then when your doctor says come back in 6 months, but problem number 3 has never even been touched, then you can kindly say, I'm going to go ahead and have to come in next week to finish my last question. You're not being rude. You're not being, horsey about it. You're not going to say, okay, for 6 months and then go out and schedule it for a week. You just tell them you didn't get finished, so you're going to need to come back sooner to do that question. So again, it's communication and kindness. Document before, during, and after your appointment. And that is part of the handouts that you got. Is appointments are in 3 pieces. Before the appointment, during the appointment, and after the appointment. Any piece of that gets dropped out, and it's not going to maximize the appointment for you. Keep organized records in place. I gave you the little red book because not everyone has a place to document. You can change that out with anything else, but you have to have a place. Your health book, your documentation, your health diary. Utilize your notes to make up your doctor list of your 3 things that you want to talk about. If you are not a good note taker, and you're not serious, and you're not organized, and you can't follow everything that's going on, bring someone with you. Bring your spouse, your next door neighbor, a child of yours, a care manager. Like, there are many care management companies now. Wasn't 25 years ago, but there are now. So there are lots of choices to hire someone to go with you and keep your medical on track. Bring this support person to hear things that you don't hear. I'm not going to ask for a raised hand, but if anyone has ever been in the doctor's office, then I'll just tell my own story. When I went in, had my eyes checked, and the doctor said, you've had a bleed in my eye. You're at risk of losing your vision, going blind. That's pretty much where I stopped hearing. And he said, I've got to give you, start your shots right now. And I said, oh no, I don't want a shot in my eye. I'm scared to death. And he says, well, I have a 10-year-old I just gave shot next door. You don't need to be that kind of baby. I changed doctors, but I got shot. It's just what it is. When you hear something that surprises you, that upsets you, that you don't want to hear the word cancer, you will stop retaining any information at that point. You need a partner with you. That it's not happening to them no matter how much they love or care about you. You need a scribe, a helper, to continue taking the information that maybe you can't digest anymore. You need someone to take factual notes, to be ingrained in your medical care, give you the confidence to speak up. Because if you're just by yourself, sometimes you're a little bit too quiet. The person that goes to appointments with you can be on your HIPAA release where they can change appointments if it doesn't work out. They can pick up a prescription. They can help you out. They can become your partner in discussion the options that they took notes on that you didn't even hear. Select someone who is serious and detail-oriented. Again, this is not a party. This is not a social. So I'm going to give you a picture so that we will understand serious from party. This is my sister and I celebrating our birthday. Guess who's hardwired for a party? That's my wonderful sister Becky, who is still, if you have a party, you call Becky. If you have a problem, you call Debbie. It's the way it is. And you know if your support person is the serious one in your family or not. Choose wisely, because you're going to want this person to walk through it with you. Building a relationship with providers. Consistency is very important. You must have rapport. And you know that from those of you who run down to the wellness clinic when something's going on. And so Kathy knows you already. Ann knows you already. There's that rapport going. You can tell them anything. You can discuss anything with them. If you don't feel that way with your doctor, you either need to work much harder to build rapport and take the incentive to do that. You can make it happen. Or if you can't, like the doctor that compared me with the 10-year-old kid, I wasn't even going to try and build rapport with him. It just turned me off. So I have a wonderful doctor in the same office. We have a wonderful rapport. But sometimes you have to move on. But if you move on, building that rapport is critical. Time and honesty with the same person, that you always see the same person for your heart. You always see the same person for your arthritis. Whatever it is, you have to have rapport with that person, because you have to speak candidly with them, building trust and assuming the best of all interactions. The nurse who has become the CEO in my company constantly says this phrase, and it's a beautiful phrase, that nobody has come to work today to ruin your day. People don't do that. If they're grumpy with you, if there's something going on, it's not about you. You have no idea what has just happened to them. Assume the best. Be kind. Know your rights and insurance coverage, and this is like stepping on a hand grenade. We're not going to get everything we want out of our insurance. There are delays, and in the next few years there will be more delays. Delays on getting things authorized. Some things will never be authorized because they're not covered on your insurance. Be sure that you understand what is and isn't covered, and that you can go to the next level to have it reconsidered. You always have a right for a second opinion, and most people who get a second opinion, it's not that they really want a second opinion. They want more information from a different perspective. And insurances pay for second opinions. Understand your coverage. Utilize patient advocacy services. Every hospital, every doctor's clinic, skilled nursing has ombudsman at the skilled nursing facility. There are always advocates. If you're not getting what you want, if you've had your call light on for 3 hours, write it in your red book. You turned it on at 8:30 this morning. By 10:30, no one had come. You kept pushing it. You have times there. Don't say, no one ever comes and answers my call bell. Put it down, have the facts. Because if something is inadequate in their system, every one of us in healthcare is licensed. Doctors are licensed, nurses are licensed, radiology techs are licensed, everyone is licensed, and the facility is under state and or federal licensure. You can always, with facts, talk to people. Give them the facts, not the emotions, and you can move forward to rectify what needs to be corrected. These are, to me, the important takeaways, and the rest is in your handouts. Number one, you're your best advocate. You may do that alone, you may do it with a partner. Knowledge is your strongest power, so do your research. And individualized care happens when you speak up and you're heard. Documentation's needed to keep everything straight. We are getting more and more complex all the time. You know, does your heart medicine mess with your GI medicine? And does it mess with your arthritis medicine? We are getting complex, so you need to have real good records. Relationship building benefits every single person. And just understanding your health insurance can decrease frustration. It may not solve the problem, but if you cannot change something, the frustration is very unhealthy if it's nothing you can change. Value can be found in second opinions because it's a second perspective on what you're looking at. And always remember that nobody woke up today determined to ruin your day. The next 3 slides you actually have. Here it is. Appointments are in 3 parts. Before the appointment, your preparation, during your appointment, and then after your appointment. You have this all written down, so we don't need to go over every step of it. But your medical appointment checklist that folds out is what you can fill out. If you use it and it's helpful, let me know, I can get you more. But I'm not going to give everyone a whole bunch of them if you're not going to use them. So if you use them, let me know, and I have plenty of them, I can get you more. Gather all your medicines, not that are prescribed, but the ones that you're actually taking. Complete the portal. I think is kind of, most people aren't going to do that. So arrive early enough to fill out your information in the office. Get your helper to attend and review your appointment checklist. And pull data from your journals, or take your journal with you. If the doctor asks something about, when did you have your last fall? What's going on? You really want, especially with falls, to document the date, the time of day, what caused you to fall. You know, is it just your shoe that gets caught on the rug? Or is it, you don't even know? All of a sudden you're on the floor. Maybe you're blacking out. But falls are the number 1 cause of death in people over the age of 65. It's 58% of deaths are from a fall. That's all of us. So if you're starting to have falls, needs good documentation so that you can start working on a plan. Bring your health insurance card, your photo ID, your license, and know what your goal of care is. Second, during the appointment, there's another long list. We've gone over most of this. Arriving early, be clear, concise, stick with your goals of care. Because if the doctor's going off in this direction of very aggressive care and doing everything, and you're not even with them, then how are you going to align? If they're not aligned with you, where they look at you and say, oh my gosh, you're 80 years old, let's stop treating you. Is that what you want? You know, align. You have to be aligned with your care. Speak up, get a second opinion, document anything new that's going on, have your helper take notes, find out what you need from the appointment. I can't tell you how many times I came to patients that wanted to do the appointments on their own. Then I came to the house to set up their medication boxes. And they were taking 3 or 4 blood pressure pills. They got the new prescriptions and they added the new ones. They never took away the ones that the doctor said to stop taking because they didn't hear it. It wasn't clear. It wasn't documented. So it's very important. What are your next steps? What medications do you start? What medications do you stop? Your next appointment date, make sure that it's written down and you get it in writing. Because you can't remember the date. Your brain is so full of information that you need to have something in writing, even if they don't want to give you an appointment card. Tell them you want one. And then after the appointment, you record the next appointment. Use the portal or have someone help you use the portal to print out your summary. It's interesting. I was so proud of myself. I was up to walking 100 miles a month. It was just a big day for me. So I reported it to my primary care doctor. I said, this has been going on for months. It isn't a fluke. I'm actually walking 100 miles a month. When I printed out my summary, it said I'm walking 100 miles a week. It's great. I didn't correct him. But you know, it's not always going to be correct. And what they say you're taking or not taking may also not be correct. So they'll list your medicine, so it's a wonderful opportunity to see all of it. And then as soon as your appointment's over, you start working on your health diary again and your next appointment checklist. This is what the checklist looks like. And you can put your appointment date, the time, the provider, make sure you bring your med list, your license, those type of things. And if someone is joining you, it's very easy for your next appointment to start another one of these. You can make photocopies, you can get new ones, but for your next appointment, because what you're going to discuss with your endocrinologist may be very different than what you're going to talk to your cardiologist about. So this is a way for you to organize, focus, and maximize your medical appointments, because you do want to come out with your goals reached. And that is all I have to say about medical appointments, but you probably have a whole lot of other experiences. So Hank's going to do the mic for you for anyone that has a question.
Yes, Debbie, the problem we encountered, mainly with Judy, who has 8 doctors, is that often Judy gets the report from each individual doctor, but when we call the general practitioner, the nurse will say, oh, well, she hasn't read the report yet. And that's a pretty common thing because she's busy and has taken on some other administrative tasks. I would have thought that there's one person who looks at the whole picture. Instead, you wind up having several of your specialists reading what other specialists have said, but it's not getting through to a composite understanding. I don't know if that's normal or not, but it really is frustrating.
That is normal, and the best way to counteract that is 2 different things. You bring it in as one of your pointed things to discuss with your primary care, and whatever report you can get, you print that out and you take it with you. That's where we have to be our own best advocate. And if they're not talking to each other, you know, because when you have multiple doctors, maybe 2, maybe the endocrinologist and the hematologist will talk to each other. But then they're not not gonna talk with the orthopedist who's also involved and the cardiologist. That's why you need to have your health diary of what's important. If you get a report and another specialist needs it, you can't assume that they're gonna see it. They copy each other, and they maybe get it in the system, it may get lost, but that's your responsibility. And I think the sooner we realize these are all of our responsibilities, the less frustrated we'll be. Sad, but truthful. Questions? Can I give them any business? Yeah, Tom?
I just want to thank you for imparting 25 years of wisdom.
Well, you're welcome. You're welcome.
Well, one thing is about caregivers, if you have those gonna help you out, Connie Castillo, a private caregiver, part-time, but she helps me get out and around, because I don't drive anymore, and help her too.
Is it the same caregiver all the time?
Well, right now it's just a part-time one, goes a certain number of days a week, go out, but she's still willing to tell me if I need help here. But the nice thing is about, you really need more care and are fading. The best bet is to have a private caregiver if you can, because these others that are working for different people and for a company, they sometimes nickel and dime you and try to set rules for yours.
Well, if you have a reliable caregiver that's the same person, they can be your advocate with you. As long as it's a person that can listen attentively and take notes, they could be your person that you have go to appointments, but don't let them take you to the appointment and sit in the waiting room. That's not gonna help you.
Well, I don't do that. I go on my own unless there's a special need, or unless they take me over, but they usually go out on their own and I call them back, but most of the time, but most of the time I go out with Westminster caregivers to get me to appointments and call them, and I've got, and of course in the Austin Diagnostic Clinic, they're pretty good about that, spreading it all over the place.
A caregiver or a helper sitting in the waiting room is not gonna be as helpful for you as someone coming in and hearing what's going
We
on.
got a question right back here.
Oh, okay.
Debbie, what do you do when you go to see a specialist and he doesn't file a report on the portal?
And to spend on his portal?
Yes. I mean, there's nothing for the patient to print out and take to another doctor or,
What kind of specialist? Cardiologist, endocrinologist, what kind of specialist?
pulmonologist.
Pulmonologist? They have a portal. Have you gone into his portal?
Yes,
And there's nothing?
there's nothing. I went back a second time and I mentioned that there was nothing. And I haven't looked since my last visit, which was 2 or 3 days ago.
Can you go to his office and pick up a visit report?
I can ask for one.
I would call the office and ask for the visit report.
Okay.
Yeah, I don't work with anyone that doesn't have a portal anymore. I wish I did. Well, if you have any questions later, just feel free to give me a ring, give me a text, whatever, because probably it's a situation that I've seen and have had the pleasure of dealing with in the past. So thank you so much for your attention.